Hello and welcome to Strengthening Your Conscious Self. This is the second video in this series. In this video, I'll share the table of contents and outline of my therapy program and universal treatment plan. This video covers the table of contents for the program overview, not the actual details of the program. This means information shared in this video might be available as masterclasses, courses, questionnaires, lessons, articles, activities, or exercises. These may be in the format of interactive online portal forms, PDFs, online portal documents, or videos. Future videos on this channel that are related to the clinician's therapy program will provide more detailed overviews and interactive content. Whether you're a new client or an existing client, understanding the therapeutic process is important, and this video will provide you with a broad overview of the therapy program. First and foremost, you're being asked to engage with this program because I am responsible and obligated to include you in this process, from a legal, financial, professional, and ethical standpoint. You're going to be investing a good amount of your time, energy, and money into this process of therapy and counseling, so it's essential to understand the process and how it will affect your health and wellness. I invite you and encourage you to be an active participant every step of the way. The document detailed in this video is interactive and educational, outlining in detail the journey you're about to embark on. It's important to review every section of the document, even if it doesn't seem applicable to you at first glance. Your patience, understanding, and commitment to yourself throughout this process is greatly appreciated. Let's dive into the many components of the program as they are documented in the table of contents that accompanies this video lesson. First, allow me to outline my compliance processes as they are listed in the table of contents. The videos about the clinician introduce you to your clinician's biography, education, background, approach, philosophy, and what you can expect from therapy sessions. The next item is the clinician's ethical compliance responsibility and accountability. Why is understanding compliance in mental health counseling important? The items are the role of ethical standards, the importance of legal and regulatory compliance, the importance of professional policies and procedures, how compliance benefits clients, the reasons I require and/or encourage my clients to review their documentation, what medical necessity means, the scheduling and consultation process is the next item on the list. The Therapy Notes software, the Client Account Therapy portal, an accessible online calendar, an appointment scheduler, and account management system. The next task listed is to verify and review the completed initial consultation videos, forms, and documents homework. The homework includes my professional licensed clinical mental health counselor public disclosure statement and the Vermont legislative statutes. This also includes my philosophical and theoretical orientation, your consultation and intake appointments, and what the consultation and intake process entails. The intake and medical records chart process is next. Learn how I gather and store your personal information and medical records securely. Here are the forms I'll ask you, or should have asked you, to fill out. Client information, your address, contact information, and demographics. Client insurance form, your billing and claims information, where you can upload a photo of your insurance card. Emergency contact and other contacts form. A notice of privacy practices. Payment authorization form if you don't have Medicaid or Medicare. This is a requirement for payment collections. An optional authorization to release and request your protected and private health information and medical records. Client history form for collecting a summary and self-reported biopsychosocial assessment. And a form for listing any prescribed medications, supplements, or vitamins you're currently taking. The next item is your therapy agreement and consent for services. I'll go over the agreement that outlines the following information: my philosophy, therapeutic orientation, and approaches to psychotherapy and counseling, a confidentiality statement, my policies, procedures, services, fees, and expectations, your rights and responsibilities, a description of technology and software I utilize to help my practice run smoother, your consent for electronic communication, your consent for telehealth services, your consent for my use of AI dictation and transcription services, your acknowledgement of receipt of a good faith estimate guaranteed by the No Surprises Act, when applicable, a Medicare Advance Benefits Notice Statement, and the consent for services attestation form. The therapy agreement and informed consent for therapy services is a legally binding contract between you and your clinician. Now, allow me to share the next part of your therapy journey. The next item is the intake session format and agenda. During the first session, I will verify and review completed paperwork and videos. We will cover the following: my information, confidentiality, procedures, policies, program, and processes, your presenting problem, history, severity, medical necessity, your mental capacity, intellectual ability, readiness for change, your goals for therapy, treatment planning, objectives, and interventions, tracking your progress in therapy, reviewing the plan and making revisions, and the discharge criteria. Then we cover the intake process and paperwork. I'll guide you through completing the necessary forms and participating in the initial assessments. My private practice informed consent requirements. Consent requires you to have adequate mental capacity and an appropriate intellectual ability. The ability to safely discern health information you find online is critical. I'll help you develop critical thinking skills and a scientific skeptic attitude. Next, the program includes psychoeducational information about theoretical frameworks and models. The next item is the trans-theoretical model of human behavior and our stages of change, because understanding your readiness to change is crucial. We will determine your current stage. The stages include pre-contemplative, contemplative, preparation and planning, action, maintenance, remission, termination, and relapse and or regression. The next item is the Substance Abuse and Mental Health Services Administration Recovery Principles. These principles guide mental health care professionals' recovery approach. Interventions are self-directed, individualized, holistic, nonlinear, strengths-based, and person-centered. Interventions will strengthen community, inspire hope, support empowerment, display respect, enhance peer support, and encourage responsibility. The next item is providing evidence-based best practices. This means I utilize interventions proven effective through research and clinical practice that aligns with clients' values and strengths. The next item is discerning medical necessity, ensuring that all treatments are medically necessary for your health and well-being, and importantly, meet the medical necessity requirement imposed by most insurance companies. Next, I ask clients if they'll allow me to collaborate with other healthcare professionals. A signed authorization would be required. I ask clients to cooperate with a process that is now required of clinicians by insurance companies and regulations. First, we need to rule out any medical conditions. We'll assess to ensure your symptoms aren't due to medical issues or being made worse by medical conditions. Then we'll assess the need for medication. by determining if medication could be beneficial as part of your treatment. And at this point in the program, as listed in the table of contents, we begin the assessment and diagnosis process. We will coordinate with other professionals as needed to ensure continuity of care. If substance use is a concern, we conduct specialized assessments using the American Society of Addiction Medicine criteria. We track your progress over time with continuous assessment and outcome measures. Identifying the correct diagnosis among possible options is crucial, so we use differential diagnosis methods. We utilize standardized criteria from the Diagnostic and Statistical Manual, 5th edition. Finally, we summarize our findings to inform your treatment plan. An integrative summary with a conceptualization is presented in your treatment plan. As part of your treatment plan, we also look at your unique circumstances, experiences, characteristics, and personality traits. Through an extensive exploration, we will determine your strengths, your needs, your abilities, your preferences, and your values. For example, do you dislike reading and would prefer listening to audiobooks or watching videos? And for videos, are the visuals in videos too distracting and you prefer subtitles? Another example, suppose you prefer existential or philosophical thought processing versus emotional processing, or maybe you prefer a mind-body or somatic approach to processing experiences in therapy. Understanding these aspects is vital in creating a personalized treatment plan that truly resonates with you. We now get to the next part of the process in the section in the table of contents. Developing and implementing treatment plans. The first item is how do clinicians develop treatment plans? This outlines a collaborative process that involves you every step of the way. The second item is a discussion of the health and wellness domains. This outlines the many domains of a person's life that we'll address in therapy. The third item describes my integrated approaches. By combining different therapeutic techniques, I take an integrated and holistic approach. The fourth item is about taking action to change. Ultimately, my primary goal is to empower you to take action and make meaningful changes in your life. The fifth item is a guide to choosing objectives and interventions. This will outline how to choose your objectives and interventions, and also what each objective and intervention means. The sixth item answers the question, why do we need a treatment plan? This details why it's important for each client to have a unique and individualized treatment plan. The seventh item is, what is a presenting problem? What brings the client into sessions? What are the client's problems they would like to address? The eighth item is, what is a symptom? What are the client's unwanted or uncomfortable physical, mental, emotional, interpersonal, social, and spiritual experiences? The ninth item is, what is a long-term goal? What does the client want their life to look like after engaging with therapy? The 10th item is, what are objectives and interventions? What objectives will the client do for themselves with the clinician's encouragement and support? What interventions will the clinician offer the client to work on together in therapy? The 11th item is process goals. This describes process goals and how they differ from end-state goals. What regular actions and practices will the client commit to implementing and completing? For example, I will start recording my emotions in a mood journal every day. The 12th item is end-state goals. This describes end-state goals and how they intersect with SMART goals. What are the measurable outcomes the client would like to achieve? For example, I would like to lose 10 pounds. The 13th item is SMART goals. This reviews how to create goals that are specific, measurable, achievable, relevant, and time-bound. For example, I will commit to going for a walk at 12 p.m. on Mondays, Wednesdays, and Fridays in order to track 10,000 steps per day, to improve my physical and mental health and improve my outcome measures scores to start this week and continue for 2 months, at which time I will assess and reassess the plan and maybe add more goals. The 14th item is a self-assessment and exploration. This is an exercise that invites you to reflect on the areas you would like to improve. The 15th item is exploring the benefits of change. This guides you through understanding and verbalizing the positive benefits of making changes in your life. The 16th item is client-chosen problems and goals. This process allows you to take the lead in identifying the problem areas and creating goals that address the primary problem areas. The 17th item is the client's goals for specific problems. This process expands on the previous item, allowing you to focus on developing goals that target more specific problems. That concludes this subsection of the program's table of contents, the treatment planning process. The next item in the table of contents is developing your health and wellness plan. This process guides you through creating a personalized plan just for you. The next item is developing your best structured daily routine. This process involves establishing habits that support your goals. Specialized treatment plans can make a big difference. The next item in the list provides specific objectives and interventions from the book, Treatment Plans and Interventions for Depression and Anxiety Disorders. The next item in the list provides specific objectives and interventions from the Wiley Publishing Treatment Planner series, offering resources to support your journey, so that you can customize your experience with client-chosen treatment plans to add to this program. The next item in the list is a summary of a continuous improvement process used in therapy. As part of the process, we will conduct regular treatment plan reviews and revisions, regularly assessing and updating your plan to reflect progress and changing needs. The final item in the section on developing and implementing treatment plans is the clinician's therapeutic orientation and philosophy. It provides a review of my therapeutic orientation and my professional and personal philosophy of life. And we'll keep moving on to the next section of the table of contents, orientation and onboarding. The first item describes the orientation to therapy and sessions and what to expect in each session. The next item is a client's self-report of progress for sharing your experiences and feedback. The next item is a process where we review the objectives and interventions. The next item is why do I assign homework? It's about enhancing learning and application outside of our sessions. The next item is psychoeducation and therapy. Psychoeducation and therapy is all about providing knowledge to empower you. Let's keep going. On to the next item. Therapy session format and agenda. We have structured sessions to maximize effectiveness. The next item is technology and software. I review a summary of the technology and software I use to help my practice run smoother and more efficient. The next item is the client account portal. This includes a documents library for accessing resources and important documents. And of course, the next item is the terms and conditions of use. The next section in this table of contents outlines the long-term goals of therapy. In this table of contents, I have noted there are universal and generalized long-term goals for all clients. And I have outlined specific long-term goals for various challenges, including autism spectrum, complex grief and loss, post-traumatic stress disorder, and childhood trauma, interpersonal relationship conflict and family conflict, sleep disorders, substance use disorders, emotion dysregulation and anger management challenges, low self-esteem and dependent personality, vocational stress and financial stress, chronic pain, and disorganized attachment styles. Now let's discuss the objectives and interventions section of the table of contents. The first item is an introduction to objectives and interventions. The next item is the guided meditations in Google Workspace Shared Drive. The next item is the clinician as a role model for the client. I have listed specific techniques and courses, including sleep hygiene, progressive muscle relaxation, worry time for anxiety, finding the sources of anxiety, problem-solving skills, polyvagal theory and parasympathetic nervous system activation, visualization, breathing techniques such as coherence breathing, imaginal exposure and in vivo exposure therapy, graded task assignment, organization, time management, and planning skills training, psychodynamic therapy, humanistic therapy, strengths-based approaches, existential approaches. Masterclasses listed in the table of contents include Mindfulness Masterclass, Assertiveness Skills Training, Communication Skills Training, Emotional Intelligence, Behavioral Activation, Distraction Techniques, Interpersonal Effectiveness, Needs and Boundaries, Conflict Resolution Skills Training, Relapse Prevention Skills Training. Additional resources listed in the table of contents include the movies Atlas of the Heart and Inside Out and Inside Out 2. The table of contents includes my short list of books and movies for personal growth. Here are some of the courses I offer in various therapies: dialectical behavior therapy, motivational enhancement therapy, somatic experiencing, acceptance and commitment therapy, polyvagal theory, sensory motor psychotherapy, cognitive behavioral therapy, internal family systems therapy, Some advanced masterclasses in the program include self-guided parts work for healing, emotion regulation skills training, character strengths and virtues training, critical thinking skills training, scientific skepticism, secular humanism, I also offer several psychoeducational courses, including gender identity and sexual orientation development, Myers-Briggs and other personality models exploration. Next in the table of contents is development of a holistic and integrative health and wellness plan. Next in the table of contents are some specialized programs, including Seeking Safety for PTSD and SUD course, Cognitive Processing Therapy, 12-Step Facilitation Therapy, Making Recovery Easier course, SAMHSA Treatment Improvement Protocols for Medication-Assisted Treatment, and the Strengthening Your Conscious Self program. And now finally, we arrive at the discharge process. How will you know when it's time to end therapy and venture out after learning how to be your own therapist? Together, we will review goals, objectives, interventions, outcomes, and termination. The process includes a review of the discharge criteria. We will conduct a termination session. I will write the discharge summary and send you a thank you letter. And there you have it, a detailed overview of my therapy program and Universal Treatment Plan's table of contents. Remember, this journey is about you, and your active participation is key to making meaningful changes in your life. I'm here to support you every step of the way. Thank you for taking the time to understand the process. If you have any questions or need further clarification on any section, please don't hesitate to reach out. Subscribe to my channel for updates on content and share my channel with anyone who might find it helpful. Together, we're building a path toward health and wellness. Take care and see you in the next video.